Peace be to you all. Assalamu alaikum. Omar here, physician assistant, doctor of health education, and moderately fit middle-aged endurance athlete. So today, we are still in the month of February. So I want to talk to you guys about some things dealing with health. So one of the health issues is that it's a Healthy Heart Awareness Month. So it's the entire month of February. So for those of you all who are involved in the health education career or studies. So having said that, and that it's Black History Month, for those of you all who choose to acknowledge it, there is this issue that we have in Healthy Hearts. So African Americans or Black Americans have the highest rate of heart disease and deaths associated with heart disease. So when I say heart disease, I'm not just speaking about cardiomyopathy. There's different things. There's heart failure. There's hypertension. So I see a lot of that. I work in an internal medicine office along with being a hospitalist. So I see a lot of people who have strokes, so sometimes referred to as CVAs or TIAs, so transient ischemic accidents, so mini strokes, if you will. And a lot of it comes from poorly controlled high blood pressure. And I see this a lot in the clinic in the morning. So according to the JNC of the Joint National Committee, a good blood pressure to have is around 120/70. And if you have, especially if you have other morbidities, what we call comorbidities, so diabetes, type 2 diabetes in particular, of which us black folks have quite a large amount of that. Other things, chronic kidney disease. So I noticed a plethora of dialysis centers that are in the inner cities, along with the liquor stores. But a lot of this comes from people's kidneys shutting down, secondary to renal nephropathy, secondary to poorly controlled high blood pressure, and the heart disease that goes with it. So, one of the things that you can do is get your blood pressure checked. I prescribe blood pressure machines or sphygmomanometers to my patients. You can get one that goes around the wrist or the arm. And check your numbers. Also get your things like your cholesterol check. So a fasting cholesterol panel. Check your hemoglobin A1C for make sure you don't have diabetes, which also plays a part in heart disease. And there's things that you can't do anything about, like genetic factors. High blood pressure runs in my family, but I also I really like salty food, so I have to eschew salty, foods that are high in sodium. And I got to get out here and exercise, which I'm not crazy about, but I have to do it. I'm in my mid-50s now. So other things you can do is try to practice good stress management. So people almost ran me over, and I was in the crosswalk, and I had the cross sign was up. But I wanted to yell at them and throw a bunch of expletives. But, I didn't. I just said, all right, maybe they're texting whilst driving. I'm still alive. Let me just keep going about my run. So try to control your stress level, because high stress, there's adrenaline dumps and cortisol. These are hormones, stress hormones that we have. That can increase your blood pressure as well. So, those are things that you can do. You've got modifying risk factors and non-modifying risk factors. And do a good family history. Find out if your mother or father have got heart disease, or your grandparents, if they're still alive. Did they die from a heart attack Did they have a stroke or something like that? Whew. But this is part of trying to protect yourself and, be around for those that you love. God only knows what your fate is. I might die tomorrow or even today, but I want to at least try to modify those risk factors that I'm able. And it's part of my profession as a physician associate, a health educator. So that's it for now. For those of you guys who have an interest in joining me in this great profession, either in education as a health educator, you can get your certified health education specialist, CHES or the MCHES, or you can become a physician associate like me. It's a great profession. I've been doing it for almost 25 years now. That's it for now. I wish you guys the best of success in your positive endeavors. Peace.